Hello, everyone, and welcome to the AIHM weekly webinar series. We're really excited for actually our last weekly webinar for the year as we move into the holiday season. We're just really thrilled to have our gold sponsor, Emerson Ecologics, and Wellevate here with us for a really great presentation today on functional diagnostic evaluation of the gastrointestinal system. So as folks are coming into the presentation, just coming into the Zoom meeting, I just want to welcome any of you who are here for the first time. The Academy of Integrative Health and Medicine is a global interprofessional integrative health association working to transform healthcare, body, mind, spirit, community, and planet. And we have a long history from the 70s. We invite you to go and join our YouTube channel, youtube.com/AIHM Global. And all of our presentations can be found there for free afterwards. If you want to go back to share this out to your fellow clinicians or to your own community, we invite you to do that. And for those of you interested in longer and more deep education, we have a wonderful integrative health and medicine fellowship. If this is your first time learning about it, you can and decide to apply. You can use this to get a discount for that fellowship. So we encourage you to learn more about the fellowship. It's a 1,000-hour program based on evidence-based curriculum for licensed clinicians. So it's truly a pleasure today to introduce our two special guests, Dr. Jaclyn Chasse-Smeaton, who is a naturopathic doctor. She's the author of Natural Solutions for Digestive Health and the creator of Fix Your Digestion. She's been in practice since 2007 and primarily focuses on digestive issues. She's created dozens of free educational and paid programs through her online platform, www.jaclynchasse.com. So I encourage you to check her out. And then, of course, we're welcoming back Dr. Jaclyn Chasse-Smeaton, a naturopathic doctor, the Vice President of Medical Education for Emerson Ecologics. She's served as president of the American Association of Naturopathic Physicians and the New Hampshire Association of Naturopathic Doctors, and served on the boards of the Integrative Healthcare Policy Consortium and the American Herbal Products Association. So I'm going to pass it to you, Jaclyn. It's always a pleasure to have you on our program. And
thank you. Thank you so much, Tabitha. And we need to add to my bio that I'm a proud AIHM fellow myself.
Yes, absolutely.
Almost finished my first year of the fellowship, which has been such a wonderful learning experience. And, coming from as a naturopathic physician, I feel like I came with very great training, but I'm loving the interdisciplinary approach and getting to interact with students from different backgrounds and really, truly learning so much. So just a little plug for the program if you're considering it as a listener. So I'm really excited that we have Dr. Tita here today, and Dr. Jaclyn, you can feel free to get your slides ready if you'd like while I intro, but many of you are probably familiar with Emerson Ecologics and know us as a dispenser of dietary supplements. We carry over 400 professional brands. Our Wellevate platform allows you to really easily host an online dispensary for your practice. But this fall, I was very excited because we launched Wellevate Labs, which is really the first time that you're able to have all in one place, a place to put in recommendations for your patients when it comes to dietary supplements, but also add in laboratory testing, both conventional testing through our partner LabCorp, as well as from 16 different functional medicine lab testing companies. So if you're utilizing companies like Genova, Doctors Data, Precision Analytical, which is Dutch Test, or many, many others, you can get those all in one place in a single order for your patient. All you have to do is select the labs that you want for them and click submit order. And we handle the rest, from collecting payment to helping your patient collect the samples, get it in, and all you have to do is wait for the results to show back up in your Wellevate platform. So it makes it really easy for you to learn. But the more we talk with practitioners about it, the more questions there are about lab testing. So that's why we worked with Dr. Tita to really teach you an overview of how you can look at the gastrointestinal system. So I'm so excited for her presentation today. She's really one of the best teachers in this space. And I learned so much when I listened to her. So today you're going to walk away with a soup to nuts, like, overview of the different kinds of testing that's available for the GI system, both leveraging kind of LabCorp testing as well as the more functional panels, and what you can glean from each of them. So if you're thinking about doing some functional testing for your practice around GI health, you're going to walk away today with exactly what tests you should be thinking about and what kinds of things you can learn from them. So without further ado, thank you so much, Dr. Jillian, for being with us, and I will let you take the lead here.
Thank you, Dr. Jaclyn, so much for having me. And thank you very much to Tabby and to AIHM for having me. This is quite a pleasure to talk to you guys, to talk to like-minded clinicians about something that I'm so passionate about, which is digestive health. And there is so much that we can do for our clients and patients with this, like through this route. So let's get into it. I'm going to try my best to cruise through these in a timely manner, cruise through these slides. And I'm looking forward to hearing your questions at the end. So what are we going to talk about and why are we going to do it? So today we're going to cover different types of tests, including breath, stool, and blood testing, when to use them, what problems they can uncover, and then what insights we can glean from them. And the reason that we want to think about this is that digestive complaints are exquisitely common. IBS by itself is found in up to a quarter of the population. About 10% of people have chronic constipation. So this is highly relevant. Not only are individuals dealing with this, but digestive issues are a major reason why people are seeking care from us, why they have decreased productivity, and why they miss work. And as you guys know, as clinicians, many digestive symptoms are indistinguishable from one another in terms of their origin. So one symptom, say gas or bloating, so ubiquitous, this can be caused by literally dozens of things, right? And by many different diagnoses. So testing can help tease out like the underlying reasons of what's going on, which of course leads us to better treatment and of course, lasting relief or actual relief. From a practical perspective, over-the-counter medications and digestive aids, we Americans spend a ton of money on them, approaching $9 billion a year. So that is quite a bit of pain and suffering that we can help deal with. And sort of continuing on this vein, there is in the medical community a sort of lack of consistent widespread knowledge of the microbiome and how to address these imbalances. So an imbalanced microbiome, the umbrella term for that is simply called dysbiosis. And we know that dysbiosis underpins a plethora of gastrointestinal diagnoses, right? Including irritable bowel syndrome, inflammatory bowel disease, celiac disease, but also so many other things like type 2 diabetes, like neurodegenerative conditions, depression, hypertension, even blood sugar issues and fat absorption issues and more. So when we use testing to get this like very specific, highly curated objective data, and we combine it with good history taking, right? Asking the right questions about symptoms and history and their timelines and their family history and all of these things, we can get enormous relief for people, often faster and with less financial investment than not using the testing. So it's a really good tool. And then one more thing I will say is that this pandemic that we're about to enter our junior year for, guys, we're like going on year 3 of this, it is making a lot of people, I would say most people, chronically stressed. And we clinicians know that for many folks, stress shows up in the gut. It shows up in the digestive system. In fact, I would argue if you want to impair someone's digestion, You want to stress them out. You want to get them underslept. You want to like get their mind racing. You want to give them insomnia. So we have a really fabulous segue here to make an enormous difference for folks. So here we go. Let's jump first into breath testing. So first, what do breath tests assess? They can assess a wide variety of things. They can assess SIBO, they can assess fructose malabsorption, they can assess H. pylori infection. We're going to talk a little bit more in depth about SIBO. So SIBO can be hydrogen dominant, it can be methane dominant, or hydrogen sulfide dominant. And we're just going to cruise along. So what are some things that would make us think about suggesting a breath test? Clinically, what I've learned, and I have done, gosh, at this point in my career, I have done hundreds upon hundreds of both breath and stool tests. So a lot of what I'm presenting today is not just like the data and such and what we can do, but also like based on my own clinical experience, especially when we're thinking about when do we do what questions do we ask, and what things can what little pearls can we pull from this? So if your client has mostly upper GI symptoms, right? Like stomach, belching, these types of things, particularly around meals, like bloating and distension, feeling early satiety, having heartburn symptoms that are not relieved by heartburn treatment, a gnawing pain in the stomach, you might want to consider a breath test. If motility issues are corresponding with the upper GI symptoms, that's an even stronger case for a breath test. If belches, gas, or stool have a sulfur smell, that speaks to hydrogen sulfide dominant SIBO. Another thing we want to look at to think about when to suggest a breath test would be that our patient takes medications that increase the risk of SIBO, right? Like oral contraceptives, opioids, antibiotics, acid blockers, these sorts of things, or has something in their history that would increase the risk of SIBO, like one of the diagnoses that is concomitant with SIBO, right? Like IBD, IBS, chronic pancreatitis, celiac disease, like all of these sorts of things. Or if they have a circumstance in their life, like they've had a traumatic brain injury, they've had abdominal surgery, which would include like bypass surgery or resection surgery. These are all things that would make you consider a breath test. Yes. So what do our breath tests do? Essentially, they measure gases that should not be in the upper GI tract. These are gases that do not belong. So with these breath tests, we take a baseline level, right? Like a baseline sample. Then we take a solution, like a medium, which is usually like a sugar urea medium. And then samples are subsequently taken over like a period of time serially. And the nice thing about these, the beauty of these things is that they can be done either at home or in the office. So a lot of folks, again, especially with the pandemic, they actually prefer to be at home and do these tests like in the comfort of their own home. And I quite like them for that, especially something like the SIBO breath test, in the sense that you're going to be taking the test for several hours. And then also like this with the stool test, we have people, having a bowel movement in the comfort of their own home rather than at the doctor's office. So one of the biggest questions clinically of what we want to prescribe as we are doing breath tests is, what medium are we going to use, right? So the medium depends on what we're testing for. For fructose malabsorption, the medium is fructose, right? For H. pylori testing, we use urea. This is a little side note, but we can also test for H. pylori using PCR stool testing. And stool testing, we're going to get into this, often can yield like more data, like it gives you like a broader net because it analyzes the entire microbiome. And so that would arguably like increase the understanding of the entire case rather than like just going for one thing at a time. And then for SIBO, we use lactulose or we use glucose. My preference, so I have used both. I have used both, and SIBO is something that I'm constantly like reading the papers and reading the research and reading like, you know, the recommendations from the Journal of Gastroenterology and so on and so forth. And what I have come to, well, first, before I talk about that, let's go over some of the differences between lactulose and glucose. So first, glucose is absorbed proximally in the small intestine. All right, so it has the potential to miss overgrowth that's present in the jejunum and the ileum, right? Because most of it's gone by the time it gets there. Conversely, lactulose is absorbed distally, right? Thus, it can capture SIBO in all segments, right? So it is more likely to give us fewer false negatives, right? And a false negative is saying, oh, you don't have SIBO when you actually do. The good news is that both lactulose and glucose are at least 85%, if not more, sensitive and specific for SIBO. One thing that I will not say, or one thing that I will say, is that lactulose or glucose will not capture SIFO, small intestine fungal overgrowth. And that is because yeast, the byproduct of yeast, is carbon dioxide. And so that gets absorbed in the blood and exhaled through the lungs. So it's extremely difficult to assess SIFO without a small intestine aspiration, right? So that's a good clinical pearl, because you are going to get clients that are going to come to you and say that they want a breath test to see if they have fungal overgrowth in the small intestine, and we can't assess for that. Now, all right, so here's the question. Should we start with a breath test for folks, or should we start with a stool test? And as you guys may know, the answer to this question, like so many other clinical questions, is simply, it depends. So it depends on their symptoms. It depends on their history and their timeline and their subjective experience. And that includes medications, travel, their diet, surgery, these sorts of things, how long the symptoms have been going on, when they started, what makes them better, what makes them worse, does anything go alongside with them, right? Our 7 attributes. We also want to consider diagnoses that have already occurred, right? So what are the prior diagnoses? What are tests that have already been done, and what are those results? And then what treatments have they undergone, right? So for example, if someone has had stool testing and it was found that they had, generalized dysbiosis and they had IBS, and they were getting treatment and treatment was not working, that makes a very strong contention for doing a breath test to confirm or deny SIBO, because we know that SIBO can go alongside IBS and so many other conditions. So if someone has a diagnosis and they are not getting better with treatment, then you may want to consider a breath test. If somebody has more upper GI type symptoms, if they're closely clustered around meal times, you would maybe want to think about breath. If someone has more generalized symptoms, or maybe their digestive symptoms are like below or around the belly button, and they kind of like progressively get worse as the day goes on, and they have lots of lower gas, and they're maybe embarrassed about that gas, then we might want to consider stool testing. And the thing is, both breath or stool testing are going to be highly relevant in, probably more than half of your cases. But using these little nuanced questions, the history, the timeline, these can help you sort of ferret out which would be more appropriate for your particular patient at that particular time. So if symptoms have started post-travel, with an illness, or with food poisoning, this speaks to generalized dysbiosis in the large intestine, and I would go for stool. The cool thing about stool testing is that it can be extremely comprehensive. So a lot of the labs that Wellevate is offering, they can be extremely specific or they can be extremely comprehensive. Clinically, I prefer the large, comprehensive stool tests that analyze the microbiome and like all of these things, because it gives a wonderful snapshot, a beautiful total picture into the GI tract, which includes like the microbiome, right? The good guys, who's there, who's not, also to digestive capacity, to your immune and inflammatory markers, right? The only thing that a stool test cannot do, because it is stool, is that it can't pinpoint overgrowth or infection to the upper GI tract, right? We don't know if it's coming from the upper GI tract or if it's coming from the lower GI tract, because we only have the output of the entire GI system, right? Which is the stool. So if you want that large picture, go for a stool test. If you've already done a stool test and or you're confident that it's an upper GI problem, or you're really thinking it's like SIBO or fructose malabsorption, then I would say go for your breath test. Now, stool testing is something that I use a lot in my practice clinically, and again, have given innumerable clients fast relief, quick answers. So stool testing assesses many forms of dysbiosis. And again, remember, what I call dysbiosis is just an imbalanced microbiome. There can be too many, there can be overgrowth, there can be too few good guys, there can be frank infection, there can be translocation. So with your stool test, this is going to assess many forms of dysbiosis, but it's not going to assess SIBO. It qualifies and quantifies your microbiome. Who's good, who's not good, and then who are the, the frenemies, the in-between, the ones that can take advantage when there's an opportunity. It also identifies the presence of pathogens and parasites. It also measures digestive capacity, like with elastase 1 and with like vegetable fibers, with protein, like meat fibers, things like that. Immune activity, calprotectin, which is an inflammatory marker, zonulin, antibiotic resistance, and more. So again, it's just an extremely comprehensive look, extremely helpful if there's a GI origin in the case. Now, the question with stool testing is it preferable to get PCR or a microscopy-based stool test? And again, it depends, because there are advantages and disadvantages to each. So microscopy can overreport the presence of yeast due to the preservative, due to the medium, and it can miss pathogens and parasites that aren't actually like physically in the stool, where PCR testing will capture that, because if the genes are there, even if the actual worm or protozoa isn't in the physical stool, their genes will be there. So it can definitely help capture those things that might be missed by microscopy. Microscopy will also under-quantify anaerobes, and that is simply because the anaerobes, as they're exposed to oxygen with defecation and collection, they're going to start dying off immediately. Even if their little bodies are dying, though, their genes are still going to be there. So PCR will capture that. PCR, this is a bummer for me. PCR does not do culture and sensitivity trials where microscopy will. So microscopy, if they find a bad guy, they'll grow it out, they'll culture it out, and they will test it against conventional antibiotics and then natural antibiotics. That can save you also a ton of time and money in terms of being able to cut right to the chase, like what substances are going to work against whatever bad guys are present. So I do appreciate that. So the bottom line is here. So I have used both types of testing throughout my career. A multitude of tests, many of which Dr. Jaclyn had sort of mentioned at the beginning of the presentation, and that we'll talk about afterwards. But currently, I prefer the PCR-based tests more, because I think that they can capture a lot more. And thus, if you can capture more, you get that bigger picture. You get more answers, you get the right treatment plan going, and then you get your patients relief faster. And that is what we want. And that is what we're going for, is that we help people feel better faster, especially where other folks may have failed in that endeavor. Now, I want to take a couple minutes to talk about some of the different trends that we'll often see in different sections of stool testing. So with your stool testing, and I'm talking generally now about like the comprehensive ones, but you can piecemeal order this from many different types of stool tests. Again, I just prefer the large comprehensive ones. So what we usually see, or not usually, but themes that we can actually see low numbers of beneficial flora. Low flora actually mimics signs of overgrowth and infection. And you guys have probably seen this clinically yourselves in practice. So the numbers, they can be low in any taxonomic group, but the most clinically relevant are deficiencies in phyla, right? So phyla are the largest taxonomic groups. They encompass species, genera, families, orders, groups, all of those things. So if you have a deficiency in phyla, that is more clinically relevant than, say, having low lactobacillus acidophilus, like low numbers of one species. So look for low numbers of flora in the phyla taxonomic groups. The other thing that we can see is overgrown flora, overgrown beneficial flora, right? So our Bacteroidetes or our Firmicutes may be high, like a high phyla. This most often happens when you see this. You'll also see an overgrowth of opportunists that are members of those phyla, and that's what's causing that drive up. Another common thing that we see, or that's very clinical relevant just to look at, is high Firmicutes or a high ratio of Firmicutes to Bacteroidetes. So this phyla, this high ratio is associated with increased caloric extraction from food, insulin signaling and blood sugar issues, insulin resistance, even like prediabetes and those sorts of conditions, right? Like metabolic syndrome, that cluster, and then all of the associated fallout with that. And again, the Firmicutes often are driven up by opportunists that are also in this phyla. So this is something really interesting to look at, especially if your clients are having blood sugar problems. Okay, this is like gold here, that the gut flora can be so influential in that. And then when we can fix it, it's incredible for them. So, couple things here. You want to take a thorough history on their nutrition, including like throughout their lifetime, right? Like, were they breastfed? Were they formula fed? Were they, when were they introduced to solids? Like when they were children, did they have like fixations of food where, like, I don't know, they only ate white foods for 5 years and these types of things. You also want a good history of their medications, right? Particularly when we're talking about gut stuff, antibiotics, proton pump inhibitors or acid blockers, laxatives, atypical antipsychotics. You also want to know about like travel, illness, where they work, and exposure to pets, farms and farm animals, wild animals, gardening, camping, drinking from hoses, working with small children. Like all of these are clinically relevant to the big picture. And this information coupled with the testing will help you hone in on a treatment approach. Another goldmine of information for stool testing is the opportunists. So these are guys that will often take hold when flora is low, when stress is high, or when there's some other form of imbalance. So the emphasis is indeed on opportune. So overgrowth of opportunists is a form of dysbiosis, is a form of microbiome imbalance, and we definitely want to pay attention to it. And it's important because our symptoms here, they can range quite literally from no symptoms at all to severe, where folks can like barely get out of bed. Now, the presence of certain organisms can actually confer symptoms that are specific to them. And right, so I'm saying that, and there's lots of like lists online. You can look all of that up, like which you know, some predispose one to histamine overgrowth, some are found with SIBO. You know, there's a whole plethora of organisms that can confer different symptoms. But then again, it's also important to know that many of these symptoms overlap, right? Many of these symptoms are indistinguishable from one another. And again, that is why testing is important, because how else are we going to tease out what exactly is going on? So here's just like a very short list of some of the bacterial opportunists and what they are associated with. So obviously this is not a comprehensive list, but we have some that are associated with antacid use, right? And those are listed out for you. We have some that are associated with antibiotic overuse and resistance. And these guys can like easily overgrow when antibiotics are taken. We have some that are known to release histamine in the gut. We have some that are associated with SIBO. And then we have some that can like actually damage or harm the lining of the gut and or are associated with inflammatory bowel disease and colitis. And actually, in the case of Mycobacterium avium paratuberculosis, we have a correlation also with rheumatoid arthritis and some of the other autoimmune conditions. So again, there's these like little nuggets that can be embedded throughout the stool test results that we can pluck out and add to the complete picture. Again, getting them relief faster. Now, another cool section of stool testing is fungus, right? So we all know that certain types of fungus can be part of a normal microbiome, right? Including Candida, like different species of Candida, including non-albicans forms of Candida. Microscopy stool tests do tend to overdiagnose fungus. Some yeasts are actually like dietary artifacts, like from like cheese production or wine, and they have virtually like no clinical symptoms. That's Geotrichum. Some yeast can be very dangerous for the immunocompromised. The thing to know about yeast, again, and I mentioned this earlier, but something that I really want to hammer in for, you know, integrative clinicians, because yeast can be like a tricky topic for us, particularly in the conventional community, is that yeast release carbon dioxide, okay? It's then diffused into the blood and is, you know, exhaled through the lungs. So yeast itself doesn't cause a lot of gas and bloating like bacteria and other organisms can, because it's immediately pulled into the blood. Yeast also happens to be one of the easiest microorganisms to treat, arguably easier than bacteria in my clinical experience, right? So like your high dose probiotics, Saccharomyces boulardii, alicillin, nystatin, so on and so forth. The exception to that would be if someone is immunocompromised, yeast and fungus can be an enormous problem for them, for these populations. All right, loves, moving along. I see a lot of low-level parasites and pathogens in the comprehensive stool analysis tests. And this is why, again, I prefer the comprehensive test rather than like the piecemeal smaller ones. So parasites are those organisms which live and feed on the host at the host expense. Pathogens are organisms that cause gastroenteritis. They like make you feel either horrible or like not so horrible, right? There's a whole spectrum there. So the stool tests both qualify and quantify protozoal and worm parasites and bacterial and viral pathogens. Again, there's dozens of parasites and pathogens that these tests seek and search for. Now, we can get even more information if parasites or pathogens are present. We can look at some of the immune markers that are in the comprehensive stool tests, right? Like SIGA, calprotectin, those guys. If you have high inflammatory and high immune markers, you have like an overstimulated immune system, and you have parasites and pathogens present, even if they're not in high numbers, that should absolutely be treated because we're having an inflammatory response. So again, we're getting like more and more niched in our approach with the information that we're gleaning. Most parasites and pathogens are fairly straightforward to treat. You always want to look them up though, because for some, antibiotic therapy is contraindicated because of hyperuremic syndrome, right? So we always want to like look those guys up if they show up, right? If something shows up, look it up. Another aspect of stool testing, which is incredibly helpful, is the section that goes into markers for intestinal health, which is the digestive capacity, right? Which is our ability to break down macronutrients, right? So do we have adequate enzymatic output? Like elastase 1 is a enzyme released by the pancreas independent of enzyme supplementation. It's a great marker for like just general good pancreatic output like function. We also have markers looking at like our bile output, our ability to digest and emulsify fats, our ability to break down proteins. So this is important because low digestive capacity can actually mimic dysbiosis, right? So again, it's about teasing out those little pieces to get the bigger picture. The other markers for intestinal health that we can look at, fecal occult blood, obviously enormously important, SIGA and anti-gliadin SIGA. So the anti-gliadin SIGA is not diagnostic for celiac disease, right? This is not correlated with blood levels. This is just at the level of the gut, all right? So that's also important to know. We have calprotectin, which is a conventional test that is sort of like that gold standard to look at inflammatory bowel disease, progression, treatment, and how treatment is helping or not. Calprotectin can also be high if H. pylori is sky high, if there's chronic NSAID use, and sometimes with other parasites and pathogens. So I have seen several reasons for calprotectin being high. We also have zonulin and antibiotic resistance genes. So again, guys, just an enormous comprehensive picture. Why should we care about these things? Again, because low digestive capacity can mimic signs of dysbiosis. It increases gas and bloating. It can create motility issues if it goes on long enough. And then if it's really going on long enough, we can also create nutritional deficiencies, right? Particularly in the B vitamin complex, iron, and the fat-soluble vitamins A, D, E, and K. They look similar. Low digestive capacity and dysbiosis. They look very, very similar. So I mentioned earlier that the measures for stool testing, elastase 1, right, that pancreatic enzyme that's independent of enzyme supplementation, steatocrit, and protein fibers. So it's good to know about the protein fibers that the protein fibers are in microscopy testing, but not in PCR. So that's maybe something to consider if folks have been on, I don't know, acid blockers forever, or if there's lots of fermentation and those types of things. Again, taking your good history there. So we've sort of already covered this, that elastase 1 is the pancreatic enzyme independent of enzyme supplementation, right? And the labs qualify it with 200 being sort of that like cutoff point for low pancreatic output. And that in turn correlates with all of these other things. Steatocrit is a marker that when it's high, it signals increased fecal fats. So this could be from maldigestion, which is a breakdown issue, right? Which is a bile issue, or it could be from malabsorption. Malabsorption is an absorption issue that's coming from either excessive fat from the diet, maldigestion, or from damage to the lining of the GI tract, right? So then we would correlate that back with our inflammatory markers, with zonulin, all of those things. Now, SIGA and anti-gliadin SIGA. If SIGA is high, we want to think about a frank recent infection. This is signaling active immune activity, right? It's like the immune system is on, it's going. If it's low, it's possible that the immune system is tired or the body is under-resourced in some way, right? Maybe this is a very chronic infection, or maybe we have some type of exposure that's been going on for a long time, or we're chronically stressed, or there's an issue with chronic low protein intake, whether that's from caloric restriction, orthorexia, these types of things. Now, anti-gliadin SIGA is, again, it's different from serum gliadin IgA, right? It is not diagnostic for celiac disease. So for that, if you're suspecting celiac disease, we definitely want to order blood tests for that. It is, however, suggestive of immune activity in the gut against gliadin, all right? So when it's high, I often would recommend a blood test for celiac disease. And then after that test is taken, we do a trial elimination of gluten. If the blood tests come back negative, we can challenge gluten back in. If they come back positive, then you're going to want to do further workup, like maybe a small intestine biopsy. You also, in these cases, definitely want to look at zonulin for the permeability issues. Next, we have calprotectin, which is a protein complex that's released by neutrophils. It is the most studied marker of intestinal inflammation, and this is even in the conventional community. So this is actually quite a conventional test that we can order. And again, as I said before, those high levels can also be caused by H. pylori, by NSAID use, by polyps, by diverticulitis, and cancer. Zonulin is a fascinating compound to assess because this assesses intestinal permeability, right? And we know that intestinal permeability can create a whole plethora of problems for our clients. So when this is high, I absolutely recommend doing a 4-week elimination challenge of gluten, and then also adding things and products and behaviors in that support gut restoration. This is also something that's very important if you have autoimmune clients to just like assess permeability, because we know from the work of Alessio Fasano that folks that have autoimmune conditions are, if they eat gluten, they're more likely to have high zonulin and then high permeability, which in turn just gets this like nasty feed forward cycle of autoimmune dysfunction. However, it is good to know that high zonulin can also be caused by other things, right? Like binge drinking and cardiovascular exercise, right? So like if you go for a run and you run 2 or 3 miles, your gut is a little bit more permeable than it was before. The difference is that after exercise or after binge drinking, the permeability will go back to baseline normal. When zonulin is high, when it's always high, that becomes an issue. That's dysfunctional, all right? And this is important to know because increased intestinal permeability underpins a lot of other digestive disorders like inflammatory bowel disease, microscopic colitis, celiac disease, these sorts of things, all more prone to increased permeability. A very cool thing that this looks at also, the comprehensive stool test, is our antibiotic resistance. So it looks at antibiotic resistance to H. pylori, if we happen to do an H. pylori test. And then it also looks at resistance to antibiotics in the microbiome in a more general way. And it looks at these different classes of antibiotics: your macrolides, your fluoroquinolones, your beta-lactams, and vancomycin, and all of their derivatives. So this is also extremely relevant information because it will help you guide your patient in avoiding these antibiotics that potentially could be harmful for them, or not potentially, like they're not going to work. And when we take antibiotics that our microbiome is resistant to, that further incurs and induces more antibiotic resistance. Now, just a couple quick things about blood testing. And I'm spending less time on blood testing. It's sort of like, I think, the last slide before I wrap up. Basic blood tests still can give us a lot of good info into certain aspects of digestion. And when I think of like, all right, what are those things? It's like the biliary system and the hepatic system, right? So we get a great insight into gallbladder function, right? If folks have gallstones or sludgy bile or biliary dyskinesia, like all of these things can be assessed via bilirubin. Liver function tests are a fabulous, like kind of large scale evaluation for fatty liver, cholangitis, all of those sorts of things. We also, through the blood, can diagnose celiac disease, irritable bowel syndrome, systemic inflammation. And systemic inflammation is found often in inflammatory bowel disorders. And then we can correlate that back to calprotectin, right? SIGA, like all these other things. So there's this web where everything can kind of interchange and cross-confer and like cross-confirm or deny each other based on the complete picture. And then, this last point is that we can assess for anemia and nutrient deficiencies that are caused by digestive conditions and or digestive distress. So we really can get a fabulous picture, enormous insight, whether we use blood, stool, or breath testing. And with that, my loves, I thank you. And I'm gonna turn things back over to Dr. Jaclyn. And I'm an Instagram person, so if you guys like Instagram, let's connect there. I'm at Jillian Tita on Instagram, and I'm there quite often. So thank you guys so much for listening to my presentation, and I'll answer questions.
Thank you so much, Dr. Jillian. I always learn a lot. Like I never knew that exercise would actually increase zonulin as well. It's like so good. I pick up all these tips and tricks every time I hear you speak. So thank you so much. I do have one question, and give everyone a minute to kind of enter your questions into the chat or into the Q&A if you guys have them. We do have some time for Dr. Jillian to address them. So with the PCR testing, I know you said that it catches a lot more. It's like kind of casting a wider net. Do you ever see problems clinically where it's picking up like maybe previous infections or things that are like residual, or do you find that those tend to clear the gut and not have kind of false positives on the testing?
Well, the cool thing about PCR testing is it's not like a yes or no. It's quantified. So in the case, say someone's had C. diff before, but like they're asymptomatic now, they may have like the C. diff toxins in there, right? That doesn't necessarily mean that you would have to treat for C. diff again. So that can be something, but that would be resolved by seeing how much is there and then just correlating that with their history.
Okay, thank you. That's really helpful. Okay, if you guys have any questions, you have a couple minutes, you can drop them in the chat or in the Q&A. So when someone asked, why does stool testing not work for SIBO?
Because you cannot assess what's going on in the upper GI tract by assessing the stool. The stool, by the time it gets into the collection cup, has been through the upper and lower GI tract, right? So the only way that we can see if bacteria is present in the upper GI tract is by taking a breath test, because that is what the breath test analyzes.
Okay.
So it's literally, and that is extremely important clinically. And you guys, please don't tell any of your clients that you can assess for SIBO with a stool test, because it's absolutely false. You could see bacteria that are associated with it, like, Methanobacter aces associated with SIBO, but you cannot diagnose SIBO through a stool test. And that is actually that is, in my view, that is the major drawback of stool testing, is that it does not assess for SIBO. Likewise, an OAT test does not. SIBO is tested either with a breath test or with small intestine aspiration. And of course, the latter is way more invasive, right? Yeah. That's where you suck contents out of the small intestine and look under a microscope and count the bacteria. However, that is a way that you can assess for SIFO, which is small intestine fungal overgrowth.
Great. There is also different ways to test zonulin, like in stool and in serum. Is there a preference that you have?
Well, so I prefer stool just simply because with ZONULLA, so like those comprehensive stool tests, like you can get so much data. So I'm like, all right, if we're going to do a test and we're going to do a stool test, like, let's just do it all. Like, let's just do everything.
Okay. And is there a way to diagnose IBS with blood testing?
Yes. Yes, there is. There is a blood test. There's two markers that it is looked for. One is anti-TBD and one is, hang on, I can look, but there's absolutely a blood test for IBS. Hang on one second.
It's interesting while you look, because with IBS, like it is such a pool of symptoms that you might be able to identify that someone has it, but it seems as though the underlying mechanisms that cause IBS symptoms in people can be quite diverse. You know, like you mentioned, sometimes it's lack of, a microbiome, sometimes it's dysbiosis, sometimes it's enzymatic deficiency or vagus nerve, problems that can be so variable.
So the thing to know about IBS is that there are two underpinning things that characterize IBS. The first is dysbiosis, right? So dysbiosis can be under any category. And then the second is that like interruption or dysfunction of the enteric nervous system, right? The second brain. So those are like the two underpinning reasons, like that's what encompasses IBS. Mm-hmm. How we get there, how we get to IBS can be extremely different, right? Like you're saying, like the vagus nerve, chronic stress, food poisoning, these types of things.
Jillian, we can always follow up with that answer at a later time too. So don't feel like you need to look it up now. And I'm sure you can actually probably look up those markers as well for the attendee who'd asked that question.
Yeah, they're like anti-CBTD, like, yeah, I'm sorry. I don't know them off the top of my head. I might have them actually in here.
And then final question, are there any known common findings in stool testing for people who have neuroleptic exposure? Do you know anything about that?
No, I can't speak to that.
Okay. All right. Thank you.
But that's a fascinating question.
Hmm. And there was one more question that came through about the discount that you get with AIHM, like through the website that Jess shared. And that's only available to new customers. So if you're new to Wellevate and if you are on Emerson, but you're new to Wellevate, you can take advantage of that discount. And the same thing with the 10% off coupon with Emerson that is available to new customers only, unfortunately. Sorry, I wish you could use it all the time.
There's also a question in the chat, Jillian, for you about your courses.
Yes.
Where was it? I just saw it. I'm just gonna. When will you have your GI course available?
So all of my courses are always available all the time on my website. So you would go to jilliantita.com and then you would click the button. It says like free education and resources. And then there's like all these different squares that have all different courses and educational products.
Great. I recommend checking it out because she's created so many like free 7-day courses on that are really like a deep dive into different areas from gallbladder dysfunction to dysbiosis to so many more like acid reflux and GERD and things like that. So it's definitely worth checking out even the free resources there. They're deep and rich, and she goes into a lot of the physiology behind it. So wonderful.
This was such a great,
I definitely have one. I definitely have one on IBS. I mean, so again, IBS is like one of those things that as clinicians, we're going to bump into it all the time. I remembered one of the antibodies. So the antibodies for IBS for a blood test, one is anti-vinculin, and then the other is like anti-TBCT or something. Again, I will cycle back and get that from you guys, but those blood tests are also like 85% plus sensitive and specific to IBS. And really what they're doing is they are measuring, they're measuring like antibodies to dysbiotic bacteria, right? So that comes back to like the dysbiosis piece. So if we can keep in mind that like IBS has dysbiosis and second brain dysfunction as its like core underpinning tenets, you can do a lot of good. And then if you want to do testing where like you look at the microbiome and like, okay, what kind of dysbiosis is present, then you can help them along even more.
Great. Thank you so much.
Hey, do you want me to stop sharing my screen, Jaclyn?
You already have. I think we're
Yeah,
good.
Okay. All right, sweet.
Well, I really appreciate Dr. Tita, you spending the time with us today, and Tabitha, thank you to AIHM for the opportunity to share this information with your membership.
Thanks again. And I just really appreciate so much this webinar. It was just so full of great information. And, you know, as we all know, GI health is just like the foundation when you're looking at integrative holistic approaches. So it's an area that our clinicians are always wanting to learn more about and stay up to date on the newest things that are out there to help them and their patients. So I just want to take a few minutes to, first of all, you know, thank our gold sponsors, Emerson Ecologics and Elevate. You know, really, it is our partnerships that allow us to do so much free education and offer scholarships for everything that we do all year long. And we really, really value you all for all you're doing to bring quality, you know, supplements and now the testing to clinicians and make the lives of our clinicians much easier so that they can actually, you know, do medicine and not have to get so bogged down by the back end of all of it. So really, really appreciate all you're doing. I just want to let you all know, please save the date for our 2022 annual conference, People, Planet, Purpose, that will be October 28th to 30th in San Diego in person this year. We actually have extended our call for proposals for speakers. So if you are interested in speaking at the conference, it's just such an incredible event. We're really excited to be back in person in 2022. And we know that so many of you planned the year early on to kind of be at one or two conferences a year. So please put this on your calendar, save this date. We'll have the actual conference will get launched in early to mid-February. So we'll have all the speakers, everything will be finalized, and we'll have registration opening. But if you're interested in speaking, please go to our website, submit a proposal. We'd love to have you on our docket this year. And I just also want to invite you, if you're a clinician, if you're an organization, we are really stepping into building a global community and bringing together. We just launched organizational membership. We're really excited about really unifying and strategically finding some projects to work on together globally so that we can really transform and move forward all of the amazing work that so many of us are doing, whether that's in integrative medicine, naturopathic medicine, chiropractic medicine, functional medicine. You know, we're all really out there doing great work. And if we can strategize a bit more, I think we'll be able to really transform healthcare on this planet. So consider becoming a member of AIHM. We have wonderful resources for clinicians, networking opportunities, and lots of exciting things happening that we'll be launching at the beginning of 2022. We can absolutely change what we're doing on the planet around health if we come together to do that. So we invite you to be a part of that movement. And just remember to connect with us with the Academy. You can do that on all of the different social media channels. We are, our handle is AIHM Global, and we provide lots of free content on our YouTube channel. All of the weekly webinars are put up there after the fact, so you can always go back, and there's so many wonderful resources there. And really, you know, consider joining or gifting a colleague a membership. It's very reasonable for an annual membership, and really get involved with the community. So thank you all. Thank you all for just such an amazing year. Jillian, amazing presentation. So inspired by you and by ending our 2022 or 2021 wellness webinars this way. So have a wonderful holiday season, and we'll see you after the new year.
Thank you guys. Thank you so much.